and also renal artery stenosis with a peak pulse here, peak systolic flow, vivid and very high jet flow and high resistivity index. This is an stenosed renal artery in renal angiogram. This is the site of stenosis at the anastomosis between the renal artery and the common iliac artery. In renal vein thrombosis, you can see the reverse diastolic flow. This is normal systolic flow, but there is the reverse diastolic flow due to increased resistance in the renal parenchyma with backflow, which is backward flow, due to increased resistance in the kidney, transplanted kidney. Another this is an extra renal pseudoaneurysm, and also you can see this slow rising systolic flow with biphasic flow in the pseudoaneurysm. This is a pseudoaneurysm also. You can see the jet flow at the neck. This is cortical infarct by Gray scale and segmental infarct due to thrombosis in the segmental artery here. And on power Doppler you can see the filling defect of flow. You can see there is good filling of the normal renal cortex and medulla, but there is defect here due to infarct. Also an aneurysm with biphasic flow. You can see going in and going out flow. And also this is biphasic at the neck of the aneurysm. You can see forward flow and backward flow. This is an intrarenal arteriovenous fistula, which is common following biopsy in the renal transplant. As you can see, there is turbulence of flow due to AV fistula. This is transplant hydronephrosis following stone formation here also. You can see casting shadow and small hydronephrosis. This is urinoma, also visible on ultrasound following immediate complications. And this is a large lymphocyte, but it is not causing any hydronephrosis. If a hydrocele does not cause any hydronephrosis, we leave it as it is, because it is going to reaccumulate again. And thank you.
Any question, please?
In addition, unilocular hydrated cysts frequently demonstrate two parallel echogenic lines along the wall of the cyst, representing the pericyst and the membrane of the endocyst. When you see a simple cyst, it has single layer, but a simple cyst looking hydrated cyst will have two layers in its wall. Now this was an interesting case. It is not a typical presentation. This patient had this lesion in the liver. We know that it is not simple cyst. It doesn't look like an abscess or hematoma. Fortunately, he was having another very typical looking operation theatre light appearance giving hydrated cyst in the right lobe, and on the basis of that cyst we reported both of these cysts as hydrated cyst, and later on laparotomy they proved to be hydrated cyst. So it can appear like a lesion like this. The second ultrasound appearance of hydrated cyst is a cystic mass containing undulating, freely floating membrane, which is the classical water lily sign on ultrasound, and this membrane represents the detached endocyst secondary to the rupture. And this slide shows an example. You see a large cystic lesion filled with internal echos, and this is the endocyst or inner germinal layer membrane which is floating inside the cyst. It can be settled in the dependent portion, or it can be seen freely floating inside the cyst. Another example, you see this cyst, a large cystic lesion with membrane inside it. Another example of water lily, we see a large thick wall cystic lesion with the membrane inside it. Now the third type of presentation is a large cyst containing multiple daughter cysts with or without echogenic material matrix in between the daughter cysts. The daughter cysts consist of one or more small cystic areas within the mass surrounded by usually thick and complete septa representing the walls of the daughter cysts. This presentation is known as operation theatre light appearance or cartwheel appearance. And this slide shows an example. We see a large cystic lesion with thick internal septations and multiple daughter cysts arranged within this large cyst. Another example of operation theatre light, multiple small cysts arranged along the periphery of a large cyst with central echogenic connective tissue. A typical operation theatre light appearance, we see a large central light and all the peripheral lights are also visible. So a large cystic lesion containing multiple inner smaller cystic lesions arranged in the center and along the periphery of the large cyst. Another example of operation theatre light appearance of hydrated cyst. Now these cysts may contain multiple solid echogenic areas or thick internal septations and thick solid element when these are infected, and this was an example of an infected hydrated cyst, and we drained round about 200 abscess from this cyst. Another example of a infected hydrated cyst. Another slide showing an infected hydrated cyst. Now the fourth type of presentation is a predominantly solid looking mass of variable echogenicity, perhaps secondary to the organization of the hydrated fluid within the cyst, with multiple daughter cysts become deformed, collapsed and cramped inside the hydrated cyst. This type of presentation is usually seen after partial treatment of the cases and is also known as congealed hydrated cyst. So a congealed hydrated cyst is a solid looking lesion, but if you concentrate on it, you may be able to see the internal septations, and usually these are the patients who are partially treated cases. Another example of a typical congealed hydrated cyst. Congealed hydrated cyst. Now finally we have cysts that are calcified and have dense calcifications appearing as curvilinear areas with strong acoustic shadowing. Thin subtle calcifications in the wall of the cyst with or without acoustic shadowing may also be seen. These cysts may be considered dead and inactive, but it is not always true. So a calcified hydrated cyst is usually inactive and dead, but it is not always true, it can be active. A calcified lesion will appear as radiopaque circular structure in the right upper quadrant of the abdomen on plain X-ray. And this is an example of a calcified hydrated cyst. You can see the shadows. Another example of a calcified hydrated cyst. Another patient with a calcified lesion, the typical curvilinear bright echo giving dense acoustic shadow. Another case of calcified hydrated cyst. Now we can use color Doppler. It can add little bit, but these presentations are very typical, and usually the aid of color Doppler is not needed for the diagnosis of hydrated disease. But on Doppler, these lesions appear as avascular. They don't have any internal flow. And this was an example. It was an atypical looking hydrated cyst. It was more looking like an abscess, but the patient was not having any symptoms of abscess, no fever, no pain. It was thick-walled and filled with internal echoes and was avascular on color Doppler. Little bit about the treatment. The conventional treatment is surgery. It was thought that the percutaneous puncture or aspiration of the hydrated cyst is contraindicated because of the risk of anaphylaxis. However, both percutaneous diagnostic aspiration and percutaneous drainage with ultrasound guidance have been recently performed without significant complications, and Dr. Fazil is going to talk on these in detail. Thank you very much for your attention.
Dr. Nasir finishing the talk in time. Any question, please?
The next talk is Dr. Fazil. Apart from the fact that he is a very well-known ultrasonologist from Abbottabad, personally a very close friend of mine, so it gives me great pleasure to call him on stage for his next lecture, which is on interventions of hydrated cyst. If anybody has a question, we could actually take the questions after this lecture, since both the lectures are dealing with the hydrated cyst.
Bismillah ar-Rahman ar-Rahim. Thank you, Nirvi, for nice comments, and thank you, Nasir. You have made my job a lot easier. Bismillah ar-Rahman ar-Rahim. Diagnostic and interventional ultrasound in hydrated disease. I'll fly through some of the slides which have been discussed in detail. That is the picture of the Echinococcus granulosus, adult tapeworm in the dog's gut. The life cycle, some of the pathological and microscopic specimens. That is the picture of the hydrated of the kidney. You can see these are the daughter cysts. The cyst contains a pericyst, and ectocyst and endocyst. The daughter cyst, and the wall is thick and has got multiple layers. The microscopic picture, pathological specimens, renal hydrated of the bone, causing fracture of brain. As you already know from the previous lecture, that the features of the ultrasound, the ultrasonic features of the hydrated cyst may be a unilocular cyst with some mural nodules or hydrated sand, floating water lily sign, semi-solid type of appearance, partly collapsed cyst with some thick debrinous type of components, liver hydrated. There will be no Doppler blood flow within the hydrated cyst, as it's a foreign body for the human being, and there will be blood flow within the liver vessels. A cogwheel type of appearance or a football type of appearance